Access to information documents reveal that Health Canada authorized COVID-19 vaccines correlate with a lot more fatalities than they have officially documented. Tamara Ugolini here with Rebel News to bring you newly released access to information documents that were filed by the Canadian Independent, and they reveal over 2,000 pages worth of COVID-19 related death submissions to the Government of Canada following the injection of novel COVID-19 vaccines. As reported by the Canadian Independent, the majority of these very detailed death reports occurred between March 2020 and April 2023. They include cardiac and cerebral events, embolisms, unexpected and sudden deaths, myocarditis, pericarditis, myopericarditis, and neurological events. They note that Pfizer was the most frequently mentioned manufacturer, followed by AstraZeneca and Moderna. Now, let's run through just one of those many detailed reports. It includes a 55-year-old woman with no previous medical concerns who died following the administration of her first AstraZeneca COVID-19 vaccine in May of 2021. Page 40 details her reaction description. Less than a day after receiving her first dose, a mere 20 hours after the injection, she developed a severe headache described as lightning bolts to the brain. She self-treated with Advil and 24 hours post-vaccine, then developed abdominal pain, further described as knives to the abdomen. Her husband explained that she was in pain and not acting like herself, swearing and said, "Give me the damn," in brackets, Advil bottle. How many of these can I take in a day? The headache/abdominal pain continued for a number of days, and then she thought she was better, so she stopped taking the Advil. But that is when things took a turn for the worse. 24 hours before she died, she began feeling like she was going to vomit. And then she did vomit for 2 hours and felt unwell afterwards. The vomit was apparently a reddish color, and she thought it was from eating ketchup chips earlier. But her husband now thinks that it was not. Anxiety is noted, and I mean, who wouldn't have anxiety if they were vomiting what I suspect was probably blood after days of experiencing excruciating pain? Her husband suspects clotting led to her death and thinks there were neurological signs before death, including mumbling and loss of speech. Sadly, this woman died before she could reach the hospital. A post-mortem COVID-19 test was negative. There was a low platelet count in post-mortem blood tests, and on autopsy, they found lung infarcts and pulmonary embolism, so blood clots, as well as a fibroid, which was apparently pre-existing for 30 years, according to her husband. No blood clot in the brain was found on autopsy. Her husband then desperately tries to have this documented in Canada's adverse events reporting system. He emails back and forth with the Canada Vigilance Program, which is Health Canada's post-market surveillance program, which is meant to collect and assess reports of suspected adverse reactions to health products marketed in Canada. The COVID-19 injections would fall under this. Pages 32 and 33 detail the contents of his heartbreakingly frustrated email. "This is the wrong form," he states in capitals. "I asked about reporting an adverse effect following immunization, a suspected vaccine-related death following immunization. The form required is AEFI, adverse effects following immunization. I'm trying to follow your website instructions. This case does not qualify under the health product category you responded with below. Please send the appropriate form as you promised. I will then fill out as advised for an adverse event, death, linked or suspected to AstraZeneca Oxford COVID-19 immunization." So frustrated. I advised by telephone message and in our conversation both yesterday that the mandatory, in brackets must, submittal of the form is an issue and is in question with our local body. My initial and main request was confirmation of date and time that any such form was submitted, confirmation of if and when. This submit date is secret and has become a nightmare with the local health region. Exact region is redacted via the local coroner's office. Confirmation of this date and time is still requested. You advised that the time and date cannot be provided, but a duplicate AEFI form can be filled out by me with help from Health Canada Vigilance over the phone if necessary. The two reported forms can then be merged, you said. Please send me the form. Also, I specifically asked in telephone message and to you on your return call for an ombudsman that could assist. You stated you would speak to your supervisor and would reply. Please include that information with the form. We expect clarity and transparency. Reporting was to be expedient and timely to the national system. No cover-up or secret agreements are acceptable on matters of timely national health importance. I would prefer never to have questioned the integrity of the system. I read directly on your website that the form must be submitted by a health professional only. You said, not true. Sorry for the long story. This is holding up burial of the deceased, a date and time to confirm job was done, and vigilance system notified at time requested on behalf of family should not be secret. Please reply immediately. Indeed, that was the same time it took Health Canada nearly 2 years to streamline adverse events reporting after they removed the direct link to the reporting system webpage. Conservative MP Colin Carey pressed the federal regulatory agency about this change through an order paper question in the House of Commons in May of this year. The change happened in December of 2020, which coincides directly with when the products known as COVID-19 vaccines were first authorized by Health Canada under an interim order, effectively accelerating their rollout and subsequent use. Family physician Dr. Greg Chan testified under oath at the National Citizens Inquiry how he tried to use this system and was sent on an endless loop of links that led nowhere, eventually forcing him to complete the lengthy documents by hand.
With the rollout, it wasn't clearly communicated how to submit adverse events. I initially thought that we were supposed to do it through the CAFAS system, through the Health Canada system, but when I was initially trying to submit the adverse events online, you'd click on the link and then it would go back to another link, and then it would return back to the link of the original page. And you just go into this endless loop of trying to click to find out how to submit the information. So eventually I just printed the forms and then filled them out by hand, but that was cumbersome.
Additionally, 2 ousted nurses detailed vaccine injury reports at their hospital were not being adequately diagnosed or documented as early as December of 2021.
After the injections came out, I did notice on my floor a lot of side effects and injuries from these vaccines, and the doctors would dismiss these patients that had these problems and kind of pass them off as mental health issues and order psych consults.
I know that I spoke to a nurse who worked in Emerge, and they didn't have any mandate to report side effects, and they're already overwhelmed with busyness of doing their regular work, that they didn't have time to stop and fill out forms anyway. So it was voluntary, it wasn't required.
There was a pattern developing, a lot of neurological abnormalities, such as tingling and numbness in the arms and legs, and it went unexplained and undiagnosed. And several times I've had patients that have said, this is definitely from the vaccine. I was fine before. And now my life has changed, and and no one will listen to me. The doctors won't listen to me.
The system was already stressed before this occurred and before the firings and people being forced out. So now it's in quite a crisis. I hear from a number of colleagues that you just can't keep up with the workload, and patients deserve better than that. We always want to give the best we can, but staffing isn't there. And I think they're going to try to say that it's due to, unvaccinated COVID people, but I hear from people who work in Emerge that it's the doubly vax that are coming in with health issues. How can unvaccinated people, when there's so few of us, it seems, be plugging up the Emerge department? It doesn't make any rational sense.
All of this further validates what Dr. Patrick Phillips told me in May of 2021, that adverse events reports were being arbitrarily filtered from the national surveillance system, thereby compromising and threatening public safety.
I think the expectation of most Canadians is that we're doing very broad and comprehensive surveillance after these vaccines to make sure that they're not causing adverse events that we weren't expecting. And I was very surprised to find out that the public health is only accepting very particular cases with arbitrary kind of time cutoffs as adverse events following immunization. And I think that's very concerning because there's only a few categories, and if it doesn't fit into those cookie cutter boxes, then it's not even going to be looked at. So Canadians won't be able to be aware if an adverse event that wasn't expected is happening after these vaccines. So if you look at the case of the adverse events that happened to my patients, none of those 5 events will even be recorded. So I don't know for sure if they were 100% were caused by the vaccine, although the one that happened within hours, I'm 99% sure. But the fact is those systems are there to report everything. So then you can look later and see, are they happening more in people who've had the vaccine than in the general population? And that's how you're able to do this population-wide analysis to see if the rates are actually higher among the vaccinated than among the unvaccinated. And that cannot happen when these reports simply just get rejected because they're deemed to not fit these criteria.
As news continues to swirl about how Health Canada and elected officials misled Canadians based on contractual agreements with Pfizer and the like that stipulated the safety and efficacy of the novel mRNA products were unknown, more information continues to come to light about how many have suffered the damaging effects of the indiscriminately promoted and largely coerced biopharmaceutical products. And it looks like the true numbers are shrouded in uncertainty, something that health and government officials prefer to label as misinformation, that apparently fuels vaccine hesitancy, when in fact it's bad government and even worse policy contributing to missing information. For Rebel News, I'm Tamara Ugolini. The safety profile of these novel injections, or lack thereof, is exactly why we have launched an email campaign and petition calling on Federal Minister of Health Mark Holland to revoke market authorization of these products. If you agree that there should be no more shots, then you can get involved by heading over to nomoreshots.ca. There you can check out all of our reports on this topic and take action. Again, that website is nomoreshots.ca.